Could you please introduce yourself and your position in the organization?
Yeah, my name is Dhwani Krishnan. I'm the executive director for the THINQ Collaborative at UCLA Health.
Okay, what does your organization do?
Yeah, so we are a quality improvement clinical research organization. So we really focus on assessing healthcare delivery at UCLA Health, especially within Ronald Reagan Internal Medicine, and then designing interventions to help improve it.
Okay, what does being a member typically look like?
Yeah, so all new members in our organization first start off with our summer internship where they're introduced to our social justice, think tank, journal club, and leadership development committees. And then once they transition into becoming a general member, they are placed in one of these committees for the academic year, and they also have the opportunity to participate in our research or outreach focused projects as well.
What makes your organization different from the other pre-health organizations on campus?
Yeah, so we offer a really unique, I think, interdisciplinary view on healthcare so members can gain exposure not only to just medicine, but also to business, pharmaceutical industries, allied health, public health, and social justice as well. And we're also not uniquely a pre-health organization. A lot of our members actually end up working in tech, in industry, in not in medicine directly.
Yeah, and is there an application for your organization? And if so, when are they due? And what does the process look like?
Yeah, so we typically recruit in spring quarter, and so there's usually one informational session towards the end of winter quarter, and then one right after spring break. After that, potential members fill out a written application that has about 4 to 5 essay questions on it, and then after we review that, we then conduct interviews for those who are selected for an interview, and then make our final selection.
Yeah, and what qualities distinguish applicants as strong candidates for your organization?
Yeah, so we're really looking for people who are committed to THINQ's mission statement and are passionate about improving the lives of our community. We're really looking for interdisciplinary thinkers, strong leaders, people who can problem solve and think on their feet and are also open-minded and willing to learn.
Okay. And what is one impactful personal experience you've had within the organization?
Yeah, there's actually a lot because think is so interdisciplinary. I have had so many impactful experiences across like a variety of things. For example, I was
Mhm.
lucky enough to be able to shadow prior to the pandemic, and so getting to see like hands-on how doctors and nurses interact with each other, interact with their patients, how they discuss these healthcare problems in a clinical setting. That was really pivotal for me in my journey towards medicine as well. Being a part of board has given me like great leadership skills, a real practice in problem solving and being able to put a team together and lead a team and design a study and things like that as well.
Yeah, I think that's a good bridge to our next question, and it's what kind of opportunities are students in think provided with?
Yeah, so most of our students are in a project, and I think that's where they really get most of their hands-on experience and think from. And so, our research-oriented projects, they have the opportunity to design a study, learn data analysis, and present or publish their work. We also have a lot of outreach-focused projects as well, so they can get involved in the UCLA community, in the Los Angeles community through social justice and other initiatives. And then we also offer shadowing that we're hoping to start back up soon. Finally, in our general meetings, they have the opportunity to lead a discussion, participate in guest speaker events, participate in our mentorship program, and things like that.
Okay, and what does your research focus on, and is previous research experience required or recommended?
Yeah, so our research is, like I mentioned before, on improving healthcare quality, so on quality improvement research. Our current study, for example, is on MDR and communication. So we really look at how we can encourage collaboration between our physicians and nurses, particularly during morning rounds at the hospital. And so all of our projects are kind of falling under that umbrella at the moment. In terms of research experience, we have so many members who haven't had any research experience prior to joining us. We have so many who have a lot. So it's not a requirement. It is encouraged, but really what we're looking for is, like I mentioned before, someone who is open and willing to learn about quality improvement, passionate about our work, and can think on their feet.
Great. And lastly, is there anything else you'd like to share about Think that you didn't get a chance to?
Yeah, I did touch on this before, but I really want to emphasize that we do have a lot of pre-health members, but our organization is really for anyone looking to make an impact in the healthcare space, even if they're not really interested in clinical medicine as it is.
Yeah, well, thank you so much, Think and Wani, for speaking with us today.